jump right into the meat of pricing for startup companies. So again, thinking about the overall market, and if you think about, if you've heard of like the BCG growth matrix, that sort of thing, this is very similar to that. You know, where essentially you have 4 market cycles that drive customer response. So the first is emerging, you know, relatively new product, new service, you know, what I would call bleeding or leading edge technology. The next would be high growth. So there's that huge growth, exponential growth type opportunity where the market is just growing by leaps and bounds and you've really developed a new product. So think of something like the iPhone or the iPad, you know, within the first 5 to 10 years where it was introduced to the market. Mature is where things have started to plateau. There's a lot more competition. You know, you've kind of lost your huge competitive advantage, but because you are mature in the marketplace and you may have had first mover advantage at one point, you know, mature is when you want to start looking at, is this product got long-term viability? Do we want to change it? Do we want to modify it? So there's a lot of opportunity in a mature cycle with how to price your product. And then, of course, decline. You know, over time, all products are going to enter a decline mode. It's just a matter of when in its product life cycle that it actually gets there. But of course, for startups, you know, this area is probably where we're going to tend to focus. And that is obviously where you want to have most of your pricing focus. You can worry about the mature and decline stage later on once your company is hugely successful. So taking the 3 pricing strategies and taking the 4 different life cycles within a market, there are certain times to implement skim, penetration, and neutral. The good news is you can always use a skim strategy and you can always use a neutral strategy. The question becomes when to use a penetration. And I gave the example of Southwest Airlines with huge market growth as they're trying to grow new routes and that sort of thing. But the only time you should ever employ a penetration strategy is when there's huge market growth and you want to make sure you're growing the market. And that may mean for you, it may mean for your competitors as well. But the whole idea is you're using a low price point so you get a lot more adoption. And what I would argue is that actually for medtech companies, I would tend to focus on the skim or neutral strategy, and would I hardly ever introduce a penetration strategy. But if you're going to do it, the time to do it is when you are in that market growth life cycle. So when I think about traditional companies and how they look at product development and rolling that product in the marketplace, yeah, they typically think about the product first. So I would assume that as a startup company that's looking at a new product, you probably said, hey, there's this need in the market and I've actually developed this really cool product. And what I want to do is get that into market. So the first thing you do is develop the product. Then the next thing is you probably deconstructed it and tried to figure out exactly what your cost is, both the variable and the fixed costs. And then the next piece probably followed a cost plus type methodology to get to a price because you want to make X amount of profit or X amount of margin. And then the next step, hey, you know, there's some value behind this. So we got to figure out how we're going to take that value and ultimately sell it to the customer. So when you think about it, you've got a move from developing a product to looking at the cost to looking at a price after a markup. Then you think about value. Then you think about the customer. And what I would actually ask is that you switch this whole model around. So when you think about it, another approach could be, hey, we know there are customers out there. We have a pretty good idea of what they need. So if you think about the customer first, then you can follow the process and say, given the customer, what value would they derive from different things in the marketplace? So you understand their needs and then you understand their value. Then, when you understand their value, you can think about price. And if you notice, we haven't even started to talk about the product yet. So we're talking about the customer needs, we're talking about what they value, so you can differentiate and have maybe different products or different levels of products in the marketplace, and then charge appropriate prices to that. Then the question becomes, given these prices, what cost structure would we need to meet our profitability goals? And then you look at developing the product. So I know this is much more idealistic, but this is exactly opposite from the slide that I showed before, and it gives you a different way of thinking about pricing and your product in the marketplace. So I know that most of us are so focused on that product today, but even if you can switch some of this around and maybe think a little bit differently of, hey, now that we have this product, let me actually start back at the beginning and go customer to value to price to cost back to my product. So this is what really gives you the ability to maximize value in a marketplace. So with that, let's jump into the meat of how should I price my new product and service, especially as part of a startup company. So different considerations that you have, and this is my list. I would love some feedback, towards the end of the presentation. Would love to hear some of the things if I missed something, or if you don't agree with what I have on my list. So the first is, especially in the medical space, do you understand the reimbursement landscape? So if your product or service is going to be reimbursed, you absolutely have to understand how reimbursement works. You have to understand the DRGs, the codes, everything that go into supplementing the price of your product. So do you understand the reimbursement landscape? Second, who's your target customer and what problem are you solving? So at the beginning of the presentation, I showed the marketing mix. And if you recall, customer was right in the middle of the slide. So the target customer could be that you've segmented the market, and let's say you have 5 segments in the marketplace, but there are only 3 segments that your product or service is really going to serve and serve well. So those 3 segments, you have target customers within those segments. The other 2 segments you're going to ignore. And determining what to do as well as determining what not to do is a very, very important step as you work through this process. Are you really a Me Too product? Are you highly innovative? Are you differentiated? If you're a Me Too product, I would ask the question of, unless you have some sort of cost advantage or scale advantage, why you would even enter the marketplace. So that's something that, if you're not asking that question, I would ask it right out of the gate. And if you're highly innovative and you're highly differentiated, man, you're probably sitting on a gold mine, and you have to make sure that you're following the right process to get that product priced appropriately in the marketplace, and that you're using a value-based pricing strategy. What's your pricing model? So I'm going to cover a couple of different examples in a couple minutes, but you have what I would consider your classic model. You just put a price on price per unit, or X amount of dollars per service, and then you have subscription models, another way to approach the marketplace, and those have become much more popular over the past several years. More importantly, how do you plan to roll out your product or service? I won't go into too many specifics here. I'll cover that in a few minutes, but you have to have a very clear rollout strategy. Otherwise, you risk leaving a lot of money and wasting a lot of effort to roll out your product and service. So this one you need to give quite a bit of thought to make sure that you're rolling it out very sequentially and through a very rigid process. How do you plan to gather feedback? So one of the best things about value-based pricing is that you want to collect a ton of data. And if you're just introducing a product in a marketplace, there are ways to do that where both the customer benefits and where you benefit. So gathering that feedback, collecting that data, so the next time you go through the sales process with a different customer or a different segment, gives you that much more ammunition as well as credibility on your price in the marketplace. All right, so let's start jumping into each one of these in a little more detail. Reimbursement. So most basic question, are you covered under reimbursement? If yes, you have to understand the entire landscape. If no, that's okay, but understand it may be a slightly more difficult sell, especially as you're looking at clinical type customers who depend on reimbursement to help cover a lot of their additional costs that they run into. Do you have a coding strategy? So what I mean by that is obviously there's different codes for the different levels of reimbursement. So you need to understand not only your coding strategy, but I would develop internally something that says, I have the expertise in-house to help my clinical customer understand how to code different procedures and different products and services that go into those procedures. So developing a coding strategy internally is something that you absolutely want to do. And then, do you have the right materials when you're talking with hospital procurement? So value dossiers tend to be a pretty big thing, but really you want to be able to sit down and have the appropriate conversation with hospital procurement, surgeons, OR nurses, whoever you're dealing with, and you have a very specific talk track for each one. And of course, all the rules around healthcare compliance need to be met when you're doing this. But developing those materials is something that is absolutely critical to make sure that you're successful as you look at new product pricing. And then, of course, if there is no reimbursement, how does that ultimately change your strategy? Everybody kind of understands reimbursement and where it is, but if you don't have a product or service that's covered under reimbursement, you definitely need to change your materials, your talk track, the way that you'll have different conversations in that hospital type setting. Whether it's the administration, procurement, the clinical buyer, you just have to be able to really change your talk track and be much more effective and much more, I guess what I would say, confident in terms of the ability of what you're selling. So who should you target? Well, unless you have a clear pathway to a large tier 1 type customer, that everybody wants that large contract, especially with a brand new company, you want to avoid these large tier 1 customers. So what should you do in turn? You should actually target tier 2 or 3 customers. A couple reasons for this. They're much more likely to recognize the value of your product or service. The access theoretically should be a little bit easier, and you have the ability to structure the deal to garner feedback to continue to refine your product or service and ultimately your message. If you're dealing with tier 1 customers or large hospital systems, they're typically very ingrained in their process. It's going to be difficult to break in. And if you don't have those good case studies or efficacy studies behind your product or service, you could be wasting your time. But targeting tier 2 or tier 3 type customers, you have much more ability to go in with a pretty good story, and those customers tend to be more likely to try your product or service. And then ultimately what you want to do is for your first few customers, maybe the number is 3, maybe it's 5, maybe it's 10. You always want to build in a feedback loop to capture valuable data. And I'm going to cover this a little bit more in one of my future slides, but consider offering free products or trials in return for data. You could lower your price for X number of customers, and as part of that lower price, the deal is you get all of the data around how your product or service is performing. And then ultimately, this leads you to build the value story. Now, this won't replace an efficacy study. Those obviously are required. They're needed for a whole lot of different things. But you still have the ability, without talking specific numbers, when you're in a negotiation, to get customers to recognize the value that you provide. So there are ways around it. It could be ease of use. It could be time savings. You reduce time in an operating room. Obviously, there's a huge amount of value behind that. So that's the kind of data that you want to be able to capture. And then that helps you refine not only your value story, but it also gives you much more confidence during that next sales cycle. All right, choosing the right pricing model. I talked about classic. That's your single price for a single unit or service. Unfortunately, these tend to be highly negotiated. There's always volume-based discounts, and price could be a barrier to entry. So depending on the type of product or service that you're selling, if it's huge thousands of dollars in terms of the price, that may be difficult to sell. If it's more in a $50 to $100 price point, it may not be as big of a barrier to entry. On the flip side, and this is where I've seen a number of companies, both within medical technology as well as outside of medical technology, move to, is some sort of subscription model. That potential client I talked to about the CAT scans earlier in the presentation, one of the first pieces of conversation we had was, what is the pricing model that I should have? And when I talked about price being a barrier to entry, through a capital investment, there could have been a huge barrier to entry. However, what that company ultimately decided on was moving down a subscription model, where in their case, it was an annual fee that was paid, but there was also, per CAT scan that was interpreted, another fee on top of that. So if you think of Xerox, that's almost a metered or subscription type model when they first rolled out their copier machines. It's very similar because what it does is make the per unit cost of use much lower, but at the end of the day, it becomes much better both for you as a company and for the customer because you can definitely control and meter the usage behind it. So very repeatable. It's based on the use of the product and service. And I got to say, one of the biggest benefits behind a subscription model is it avoids any sort of capital expenditure. And I would imagine that the types of products that startup companies are developing are not really in that model anyway. But whenever you can move anything to an expense, you're definitely much better off from a financial perspective, especially from your customer's perspective. So there are a few other models out there, but the key is you have to choose the right one that will maximize value for you as a company, but also makes it easy for your customer to buy. And ultimately, think about your discounting strategy now. Don't think about it later, because what you'll end up doing is giving discounts to customers because the easiest way to get a discount is to ask for it. And if you have not planned for a discounting strategy ahead of time, you're always going to be caught off guard. So choose the right pricing model and then ultimately choose whatever discounting strategy that you plan to employ. And then think long and hard about your product or service rollout strategy. So a couple of ideas here. One, consider limiting the availability of your product or service in the beginning. So do a broad market communication and say, hey, we've got this great product or service that we're going to roll out, but we're going to only be able to provide special pricing to the first 5 customers that sign up. And then anybody after that, you're either going to pay list or pay a price closer to list. So you've created a bit of scarcity by doing this. And then if you couple this strategy along with what I talked about in terms of feedback, part of the deal with the lower price is that you can require companies to provide you a lot more detailed feedback that will help you out later on. So you create scarcity, you only create a limited time offer, but this is one way that you can roll a new product or service out that can help you do a few things that are just going to benefit you down the road. And then when you think about the future, do you have the ability to scale and administer contracts and/or pricing agreements? Contracting is never one of those fun things that we want to do, but of course, within the medical technology space, they're required. And if you can get away without one, great. And if you don't have a contract, you're going to have a pricing agreement that has some sort of expansive terms and conditions that are tied to it. So when you think about your rollout strategy, do you have the ability to administer contracts, or do you at least have that in part of your rollout process to consider 1 month, 4 months, 7 months down the road? Because eventually you're going to have to think about that. And then, have you segmented the market to target your sales efforts? So I gave the example where you may have segmented the market and come up with 5 customer segments. 2, you want to totally ignore. 3, you want to go after. But even within those 3 segments that you want to go after, there may be one that would just be phenomenal if you were able to penetrate that particular segment and really grow your product or service. So understanding those market segments will help your sales and marketing teams tailor their efforts to where you're going to get the bang for the buck. Gathering feedback. So I touched on this one a little bit. Talk about it a little bit more. If you don't have a process for gathering voice of customer, establish it. A pretty simple 10 to 15 question questionnaire will do that. And then you have to execute those interviews. So you typically want to avoid procurement because, of course, they're just going to make it all about price. But it's really the hospital administration, the clinical buyer. Those are the types of customers that you want to talk with about how your product or service helps them out in their entire process. So voice of customer, incredibly important. Make sure that you're going out and gathering that as part of this entire process. And then you need to identify the data that's going to help you improve your overall product or service. So as an example, one company I did work for, this was many years ago, was looking at a disposable scope for colonoscopies. And at the time, one of the reasons they really jumped into this space was it almost seemed like every month there was a new case of poorly sanitized scopes, reusable scopes that were being used in hospitals, and then of course cross-infection occurred and was just a bad environment. So by having a disposable scope, one of the things that we looked at was, again, reimbursement and how it would be covered, because the cost per scope was a little bit more than going and putting a reusable scope through the autoclave process and doing all the sanitation procedures. So as we started to look through that, we identified the type of data that we wanted to collect, and then ultimately whether customers, patients, would be willing to pay a portion for that disposable scope or not. And ultimately, our client decided not to roll out the product, but one of the things we learned was all of the data that would have been useful, that if they rolled out the product, that we'd want to collect, so that way they could up their marketing strategy and sales strategies to sell that disposable scope. So gathering feedback, incredibly important in terms of the type of data that you want and need. And then, of course, you refine and iterate. When I put together value-based pricing models, you end up negotiating what the customer values. You do not negotiate the price. So, a common phrase is your mileage will vary, because as you think about the different ways that you can price in a marketplace and where customers have value and some don't recognize that value, you're going to have to continue to refine that process. So a few years ago, I worked for DePuy Synthes, and we developed a new type of knee. And as part of that knee, disposable instruments were put into place. So if we were selling to large orthopedic hospitals that were constantly doing knee replacements, disposable instruments were not a target market for that particular type of product. However, smaller orthopedic hospitals that only did a few procedures each week, they were very much a target market, and we were able to put together a value story based on data and put an appropriate price on those disposable instruments. So gathering feedback is an important part of this entire process. So as we start to wrap up the webinar, just going to put up the 3 primary pricing strategies: skin penetration or neutral. I would hope that for most startup companies, when they look at their product, they employ a skim strategy, although a neutral strategy is certainly okay. And there are times to employ the penetration strategy, but I would make sure that you do your homework before you actually go down that path. And then as we wrap up the entire presentation, understand basic pricing theory. If you understand the basics of what I covered at the beginning of the presentation, that will lead you down a very different path than where you may have started before. Consider changing your product development process. So again, that was totally switching around from product to cost to price to value to customer, and going the other way where you look at the customer, then the value that's provided, and then with the different price points, can you have a cost structure that gives you the profit that you want, and then focus more on the product itself. So again, just a slightly different way of thinking, but by doing that, I think you could be much more successful in the marketplace. Choose the right pricing methodology and process. So it's kind of the classic model, the subscription model. There's metered models. If you think of Gillette or razor companies with what they do with the razor handle and the blade, a lot of different ways to think about how you actually capture your piece in the market and make sure that you're profitable. So choosing that pricing methodology in the beginning is something that is going to pay you dividends in the future. And if you look at a company like Microsoft, they've actually gone from what I would call the classic pricing model to a subscription model today. So it's okay if you want to start out one way and then change in the future, but I would put that in your product roadmap and your rollout strategy. And then, of course, have that clear rollout strategy. Don't try to go mass market all at once. I would go very iteratively. Go after those tier 2 or 3 customers. That will give you a lot of benefit in the long term. Otherwise, you may always be banging on the doors on those tier 1 customers where you might just hit roadblock after roadblock. And then, of course, ensure that you have a process to gather feedback in a marketplace. Different ways to do that, but there's no replacement for a voice of customer. So with that, I thank you for your time, and if there are any questions, I will be more than happy to field those at this point.
Great, thank you so much for that comprehensive overview, Mike. We're going to open it up for some questions from the folks here in Temple.
Yeah, Mike, I got a quick question. Could you talk a little bit about how you can go about pricing premiums on top of like the product or service that you offer? Like, for example, if a customer wants something custom added to your normal work.
Okay, so I'm just going to repeat this back to make sure I got it. So you have a price in the marketplace, the customer wants something customized, and you're looking at how to price that appropriately.
Right.
Okay, perfect. So with that, obviously you don't want to deviate from the established pricing that you have in a marketplace. Anything that's custom, of course, you can theoretically charge more for it. I would approach it purely from a value-based perspective. So I'd want to understand why the customer wants something custom, what benefit are they going to get from it? And it could be something as simple as, I'll go back to my days in orthopedics. We had something that was called True Match, was based on a custom designed algorithm to fit the patient perfectly. So the thought behind that is the value was to the patient the fact that they're getting something that was much more matched to what they already had today, as part of their regular need per se. And then the second piece is that the actual replacement would result in less revisions further down the road, that sort of thing. So I would go through a very strong value-based exercise to understand with that custom pricing, where you're adding positive differentiation compared to just the base product, and then try to capture, ballpark probably 40 to 50% of that total economic value, and that's the price I would put on that customization. There's a model called economic value estimation. This starts out with your next best competitive alternative, and that could be internal. And then you add on all of that economic value on top of that. If there's any negative differentiation, you take that away. And then that difference between the next best competitive alternative and where you're adding all that positive differentiation, that's your total economic value. And then that's that 40 to 50% price point that I would want to make sure that I capture and then charge to the customer.
Okay, thanks.
Mm-hmm.
And then I guess I also have another quick question. How do you transition from, I guess, the type of pricing that you're using? Say you need to go from a skim to a penetration model without, I guess, making your customers angry with you for kind of changing up your prices.
All right, I'm going to attempt to answer that question to make sure that I understood what you said. So if I'm off base, definitely push me a little bit.
All right.
So if I have a skim strategy, quite frankly, as a company, I'd want to protect that skim strategy as long as I could. If I needed to, because I've just lost differentiation in the marketplace, I would move down to a neutral strategy. Would I ever move to a penetration strategy? Only if it was a market, it was just me, and I was just really concerned about growing the entire market overall. Then I would shift to a penetration strategy. But I most of the time it's going to be a skim strategy is where I want to go, and then as I lose a lot of that differentiation over the competition, I want to move down to a neutral pricing strategy.
Do you just do that kind of gradually over time, or you just kind of rip the Band-Aid off and just say, hey, these are new prices now?
I would do it gradually over time. Reason being, a lot of your customer base, is probably going to be paying, relatively high prices if you have a skim strategy today. If you rip the Band-Aid off and drop everybody off, obviously that could have a huge impact to both your revenue and profitability. So I would want to do it over time, based on contract renewals, as you're acquiring new customers. So I wouldn't do it all at once. I would do it over time.
Any other questions here in the Temple group? I think you have covered everything we could have asked for today, Mike. We really appreciate your insight.
Okay, terrific. My pleasure.
And just as a quick reminder, we'll have the link for the webinar video on our THBD YouTube channel available later this week, as well as a link to Mike's handouts and presentation. So Mike, thank you so much for your time and your expertise, and we hope to talk with you again soon.
All right, thanks. Take care.
Thank you. Thanks, Mike.
Yep, bye.